Good morning, everybody. Thank you very much for coming this morning to our press conference to launch this year's National Healthcare Conference. My name is Jennifer Ahern. I am the Chief Officer and Permanent Secretary in the Ministry of Health, Sports, Youth and Culture, and I'm joined this morning by the Honourable Minister, Minister Osbourne Bodden, and by the CEO of the Health Services Authority, Ms. Lizette Yearwood. I'm going to have to offer apologies on behalf of a few people. Unfortunately, the Chief Medical Officer, Dr. Smith, was unable to join us this morning. The Medical Director of the Health Services Authority, Dr. Jefferson, was also unable to join us, and Dr. Veit, who is President of the Cayman Islands Medical and Dental Society, unfortunately asked that we tender his apologies as well. But they've all assured us that they're here with us in spirit, if not in body. So I really just want to thank you all for coming. We're really excited about this year's conference. We've been planning for a while now, and so this morning the Minister is going to announce this year's theme and tell you a little bit more about it. So with that, I'll now turn it over to the Honourable Minister, Osbourne Bodden.
Thank you, Jennifer, and good morning, everyone, and thanks for coming. We would like to announce the details of the 4th Annual Cayman Islands Healthcare Conference. Welcome, and thanks to the media for attending today, and to Ms. Lizette Yearwood, CEO of the Health Services Authority, and Ms. Jennifer Ahern, Chief Officer of the Ministry of Health, Sports, Youth and Culture. I would also like to acknowledge Tenet Healthcare, who have joined us at the highest level of Premium Plus sponsors for a second year in a row. In addition to Tenet, other confirmed supporters of the event include 21st Century Oncology, Tower Marketing, the Health Services Authority, University of California, San Diego Health System, the Wellness Center, the Caymanian Compass, Christy Tomlinson Memorial Hospital, and Cleveland Clinic. Thank you all. Thanks to all of you who have so kindly given your time, energy, and funding to our National Healthcare Conference. Your willingness to be a part of this vital event means that we can produce a truly first-class conference year after year at no cost to attendees and little cost to the Cayman Islands government, and for that we are extremely grateful. I would also like to take the time to mention that there is still opportunity for sponsorship, so if you are not already on board, please feel free to become a part of our very important conference. The 4th Annual Cayman Islands Healthcare Conference will be held at the Ritz Carlton from the 17th to the 19th of October, and will be a fully packed 3-day event that will feature, as always, an impressive lineup of highly experienced professionals from Cayman and overseas, who will be imparting their knowledge for all to benefit. The findings of our 2012 Health the Nation survey made for sobering reading. Caymanians are leading unhealthy lifestyles. We smoke, we are overweight, and sometimes even obese, and we are not getting our 5-a-day recommended amount of fruit and veg. Perhaps even more of a cause for concern, far too many of our children are overweight or obese. Based on annual health screenings on children in transition from lower to middle school, a survey found that 22% of our school children are overweight, and an additional 15% were deemed at risk of becoming overweight. In addition, among school children, there are indicators of high levels of obesity. Such risk factors within the school population are a predictor for the future development of chronic, non-communicable diseases in the Cayman Islands. We know from medical research that many of diseases such as diabetes, hypertension, cancer, and heart disease can be prevented if we follow basic, healthy lifestyle guidelines, and yet we still choose to ignore them at a great cost to our and our children's health. Conferences such as the National Healthcare Conference can go a long way in better educating us all on the consequences of not following a healthy lifestyle and reinforcing in our minds the need for change and, most importantly, how to go about making that change. So this year, more than ever, we have tried to make the conference as inclusive as possible and to get as many residents as we can to come and take part in this important event, to give everyone the opportunity to come and learn about how to look after their health. Our theme this year is Taking Care of Business, a shared approach to workplace wellness. We have chosen this theme in particular, focusing on the working population so that they may appreciate its relevance to them. Small business owners, employees, human resource managers, insurance companies, fitness and wellness professionals, the medical community, and in general, organizations interested in the health and well-being of their staff. In fact, a large percentage of our population will see that the topics we will be discussing will be relevant to everyone and not just medical professionals. This year, we will be introducing 3 separate workshops that speak to the theme of info to action. These sessions will present and expand on the theme in more detail, and all will be welcome to join the discussion and participate. These sessions will bring together the perspectives from a broad range of individuals, including healthcare providers, general practitioners, patients, and other stakeholders, to try and build a bigger picture of health issues facing people in Cayman today. These workshops will assist delegates by giving them the tools to understand how to translate information received into actual action steps. A summary of the findings of these workshops will be presented to the delegates on the final day of the conference during an overview session. I am pleased to note that last year's conference was a huge success, with 465 delegates in attendance over the 3 days. The planning committee received tremendous positive feedback from delegates, speakers, and sponsors, and they are eager to replicate the same level of interest or even higher this year. Even though we have a new government, one thing remains absolutely resolute. It is our aim to provide sustainable quality health care for every resident in the Cayman Islands, and at the same time ensure that the population is given the information it needs to make healthy choices for itself, thereby reducing the prevalence of non-communicable diseases before they even begin. We believe that arming our community with the knowledge they need to help themselves lead a healthy lifestyle is a crucial step in reducing disease. An important place to start is within the working community, which by and large is most of us. Giving employers and employees the tools to ensure that everyone employed is leading a healthy lifestyle is an important step forward in winning the war against ill health. In addition, ensuring the working populace is healthy will give an important boost to the economy, because healthy employees means less sick work days, loss to sick leave, leading to higher productivity for Caymanian businesses. We believe that this year's National Healthcare Conference will go a long way in helping us achieve the goals we have set ourselves, and we anticipate a thoroughly informative and lively debate. We now depend on you in Cayman's media to spread the word and help us get as many people as possible involved. We trust you will do your best to help us help Cayman get healthy again. Thank you.
Thank you very much, Minister Bodden. So we're really excited about this year's conference and the workplace wellness theme. And one of the key things that we want to really get down to is the information to action. Everybody knows what they need to do. Why aren't we doing it? And that's what we're hoping that with the workshops that we're having this year and the speakers that we're bringing, we'll really find a way to sort of crack that nut and get people really taking the steps that they need to take, that they already know they need to take, to really embrace healthy lifestyles and preventative health care. And as Minister mentioned, Tennant has come on board as the Premium Plus sponsor this year again, and it's because of sponsors like Tennant that we're able to once again offer the conference free of charge for registrants. And we do still have some sponsorship opportunities available, so if anybody's interested, we would welcome them to come on board. And we're getting some great speakers coming, we think, lined up. We've been working on that as well. The registration is going to open on July 2nd on our website, which is healthcareconference.ky, and we do encourage everybody to register. As the Minister said, this conference, the theme this year, we think is going to appeal to a very broad spectrum of people. It's not just targeting healthcare providers or people in the healthcare industry. We think that the subject that we're going to cover and the speakers we're going to have is really going to be able to reach all the stakeholders, all the sectors of society, whether they're small businesses, HR professionals, employees, health and wellness providers, of course, as well. But we would just encourage people, even though it's called the Healthcare Conference, it really is for everybody and anybody who's interested in coming out. So with that, I'll just open up the floor for any questions.
you. Is it on? Yeah. In this healthcare conference, will you be covering both mental healthcare as well as physical healthcare? And it's for anybody.
Yeah. And Lizette, did you want to answer that one?
Sure. We look at wellness as a very holistic approach. So yes, it will include mental, emotional, spiritual, as well as physical health. Yes.
I was just curious what the cost was to attend the conference. Is it free? It's free.
It's
free.
free.
Wow. Okay.
Yeah.
Lovely.
Same as the last 4 years. I guess the question is it people, because the Cayman people are, well, the survey showed that some of the people are overweight and not paying attention to the diets that they need to be on and so on and so on. Really, the people that are going to come to this are the people that already want to be healthier. So how do you get the people that aren't being healthy to want to be healthier? I guess that's the key question.
And that's one of the things that we're trying to look at, particularly with the workshop, is we're hoping that from the discussions in the workshop, where we're going to have a broad representation of stakeholders, that there'll be something for everyone to take away. So the healthcare providers might get some new ideas about how they can get their patients to go from information to action. And the employers might get an idea of how they can put some employee incentives in place to encourage their employees to embrace some wellness and prevention. I don't know, Lizette or Minister, if you wanted to add.
Yes, thanks, Jennifer. That's a good question because, as you say, sometimes you're speaking to the converted. We all know that, in particular, our young people are so prone to staying indoors these days, loving the AC, playing the games, that even my own kids, I've had this battle. I told one of them yesterday, I said, look now, I'm health minister, you got to get in shape. He said, Dad, you go on. Anyway, but we do have a challenge, and I think this is not necessarily at the conference, but it goes from the conference because we have to convince those that are there of the importance of it. But I see it also from a government perspective, myself, our ministry, and our education ministry in particular, working closely in hand, because we have to get into our schools and really, really pound this home. We have to get our young people starting to understand that, yes, we love our Caribbean food and it's all good and tasty, but we can have it sometime, but you can't have it all the time, and you got to be more active. So I think it's a holistic approach that we're looking at.
Yeah, I'd just like to add as well, even when we started planning the conference, before we even determined what the theme was going to be, what we did was we reached out to a broad spectrum of stakeholders, had them come to the table. We actually had a planning charrette to say, what do we need to do in order to improve the health of our country? So we had stakeholders from across the board, including the insurance sector, who really came and said, these are the issues that we are seeing, and this is what we think we can do to actually try to come close to finding the answer. So I think, in addition to what Jennifer said, I think if we can get all of those stakeholders to the table, even though they may be the converted, they may actually have some of the information that if we can put it together, we can actually find a solution that will go toward meeting that goal.
Are there any other questions?
What's the biggest health problem facing the health industry right now?
Apart from funds?
I guess it depends on what perspective you want to take.
Yeah, I mean, there are a number of challenges, actually. The minister mentioned one of the biggest ones, which is obesity, especially in childhood. So we have various stakeholders who are actually looking to address some of the issues that is causing that. We also have a number of problems with hypertension, and again, that goes back to the obesity and the unhealthy living, the unhealthy eating is all part of that problem.
Yeah, certainly the chronic non-communicable diseases are probably our biggest health challenge, and it's particularly vexing because they're preventable. And so that's one of the things that we're hoping to get to with the conference, is that we'll find some really concrete ways that we can take some steps now that we have the data from the Healthy Nation survey. So we know what the risk factors, the predominant risk factors are that we have to try and address. And with the conference, then hopefully we'll be able to start taking those steps to really encourage everybody. And as Minister said, starting with the children and the youth, but also with the adults as well, making them take the steps that they need to take so that we can sort of stem this swelling of chronic non-communicable diseases. We can't afford them as a country. We can't afford them, the productivity that we lose when people are sick, and the actual cost of treating them is something that we really need to get a handle on. So prevention is really where we want to hammer.
I just use this opportunity to give a plug to the Lions Club efforts, which is the PACE event next weekend, and a good example of diseases that really shouldn't be killing us anymore, colon and prostate, testicular cancer. It's important in particular for males to get themselves checked, put away some of the stigma and the pride, and get out there and get yourselves checked. I know last year's event was a huge success. They raised substantial funds, but more so the awareness. And after that, it was, I think Ms. Yearwood can attest, but there was a significant increase in screenings. And we're hoping that as this event continues, people will do that. So I'm asking you to support the Lions in their efforts with sponsorship and participation in the 3-day walk next weekend as well.
Another question?
Talking about healthcare, and I know the recent mental health care bill, is that on the table yet? Is that?
The mental health law was approved by the Legislative Assembly, but it hasn't been commenced yet because we're currently working on the regulations that we need to have in place before we can start it, put it into force. But we are working on it actively, and we're hoping that we'll be able to get the regulations approved and commence the mental health law 2013 very soon.
An area that's very, very, very important and near and dear to me, I've told CEO already. In fact, we've already met briefly with Dr. Lockhart, and we are looking in the future to do make substantial inroads into mental health care. Very concerned with the amount of increased cases that we're having, the fact that we still have to send our people overseas largely, and we're certainly going to be looking at providing on-island facilities. So that's something that will be upcoming once the funds are available.
I just noticed, being, now in the working industry and things like that, that a lot of offices don't actually have sick bays. So therefore, a lot of the people have to go home. Is that something that you've, maybe thought about by doing this healthcare conference?
Is that? Do you want to take that one? Or?
Well, as far as the awareness is concerned, I think that's what we need to do, work with the employers to identify what some of the needs are and work with them to determine how we can help them as well. I mean, we do offer various services. For example, when the flu shot is available, we will actually go out to the various corporate entities and administer the flu shots, and we will work with them in regards to that as closely as possible.
And hopefully from the conference we'll get enough employers coming and getting interested in terms of some kind of an employee wellness program that we'll start to see a better awareness of those things and more things being put in place.
Okay.
All right. Well, if there's no further questions, I just want to close by thanking all of you for coming this morning, reminding everybody that registration will open on July 2nd. www.healthcareconference.ky is the website where you can go to register. The conference is the 17th to the 19th of October, and it will be free of charge, and there are still sponsorship opportunities available. So thank you very much, ladies and gentlemen. Have a wonderful day, and I'll look forward to seeing you all at the conference in October.
Thank you all.
Thank you.